engagement. And so the themes from our discussion today, as you can see that we're recording it, they may be used in possible future publications or white papers. So we just want to make you all aware of our blanket templated IRB statement that you see up here. And if you ever have questions about our IRB protocol, please feel free to contact our program manager, Sarah O'Connor, whose contact information is always at the end of our sessions together. All right, next slide, please. So without further ado, I'm happy, always happy to join my two colleagues, Dr. Brian Johnston and Dr. Stacy Young, to facilitate again what will be the final session of our three-part series. Dr. Stacy Young might be joining us a little late today, and so we'll welcome her when she joins. But with that said, I will turn it over to Dr. Johnston to set the stage for us today.
Thank you so much, Dr. Ruffalo. And I totally get it about the championship. Go Bucks. No problem. But it's great to be with you guys, and I'm especially happy to be here with to be joined with a couple of students at MCW who I've had the great pleasure to get to know and work with over the course of their careers. I'm here with Josh Matsky, who is a fourth-year student, and Will Mead Davies is a third-year student, and they are really kind of exemplars when it comes to community engagement and what that can look like on the student side. So we're gonna have some really interesting discussion, I think, today around that. So today we're charged with talking about dissemination and capacity building. And sometimes those go together, sometimes they go separately. But I think that there's some easy ways to think about these topics, and there's some more nuanced and more complex ways to think about them. And I hope we'll get to a lot of these different areas during our discussion today. But I guess I was thinking about what would be most useful for the students here to learn about. And I think that really just will come from a lot of what Will and Josh have to share about their experiences and the capacity that they've developed and they've seen their partners develop during the course of their work in this area. So I just wanted to start by asking, maybe we'll start with Will, if that's okay. And we'll just ask if you could introduce yourself to the group here and talk a little bit about your community engagement projects, I should say, that you've worked on.
Yeah, for sure. Hi, I'm Will. I'm an M3, like Dr. Johnson said. So my community engagement project that I worked on last summer with MSSRP was looking at food insecurity in the geriatric population in Milwaukee. And I ran this project through the All Saints Clinic, which is where Dr. Johnson works. And so it kind of started out with just thinking about how food and food insecurity play into health and how important that is, but also how many community food resources are available, but also how it can be kind of a difficult challenge to like navigate that whole system. So to make it easier for patients in that regard, I kind of aggregated a lot of like information about community resources and was distributing them at the clinic to the elderly patients. So that was a big part of it. And then I was screening the patients for food insecurity and then conducting interviews over the phone just to learn a little bit more about like what the patient's experiences have been and how they interact with like the various resources that are available in the community, and then what they see as kind of the strengths and weaknesses of those programs in terms of, you know, ease of access and how they're using them. And then the other project that I'm involved in as well with Dr. Johnson is the Food Doctors Project, where we go and teach nutrition lessons in schools in Milwaukee. And that has also been a super cool experience. And yeah, I think that's basically it.
Wonderful. Thanks, Will. Josh, I wonder if you could introduce yourself and talk a little bit about some of the community engagement work that you have done.
Hey guys, I'm Josh. I'm an M4 now, which is crazy to say. My initial scholarly project and community engagement project involved the community of those experiencing homelessness in Milwaukee. So I spent a year just learning in the community and spending time in the community and trying to understand what the needs were in the community. And after a year came up, Dr. Johnson and I talked, and pretty much like just like I still had no idea what the needs were, and then it like kind of dawned on me that the best way to figure out what the needs are of the community were was to just ask them. So we created a needs assessment specific to the community of those experiencing homelessness here in Milwaukee. We developed a survey, and then I had been working directly with Street Life Communities, which is a homeless outreach group that goes out now 3 times a week around the city of Milwaukee. So I took my survey and went out on outreach rounds with them like I had been doing, and administered that on the rounds and collected the data and analyzed that. And then just recently finished putting together a manuscript with that that really analyzed the needs from the community's perspective, which I think is really important. So exciting things coming from that. And then my honors project, I'm working with Dr. Nelson in the Department of Family and Community Medicine, and we're doing a literature review and working with community partners to better understand the current data collection for homeless mortality in Milwaukee, because there currently isn't really a landscape that is working on that. So we're working to figure out what's been done in other cities, figuring out what's currently being done here, and then coming together to develop a potential solution for that.
Excellent. Thank you both. And I think you've both been kind of humble with the way you've talked about your roles in the projects and kind of the impact and what's come out of those projects. What's been something that's really surprised you about the work that each of you have done in the community?
I think really like the people themselves have surprised me, like their willingness to like take it. Like I am from a tiny community in central Illinois. Like I like coming into Milwaukee was like a giant culture shock for me. So like for my community partner and then the community themselves to just like adopt me and work with me and like just take me in was definitely like the most surprising thing. I think like the relationships that you can build by through community engagement and community engaged research are like really, really deep and personal and like can be a foundation for a career. And like, I think that's been like the most surprising thing that I found in my research.
And Josh, you're talking about relationship building there, which I think has a lot of implications for your, your future and all of our futures as physicians. That's so much a part of our role is building relationships in 15 minutes, with all the other stuff that we have to talk through. So tell me a little bit more about that. What have you, what kind of best practices have you learned about building relationships? What kind of things do you feel like you can carry forward from that into your future clinical roles?
Yeah, I think like the most important thing like I found in building those relationships is like the first like step is to just like leave all of like the baggage and like preconceived notions that you have about like any setting or any community, leaving those behind and just like kind of taking a step into the community and just like looking around and listening. I spent 2 years just listening and watching and asking questions because like it was very evident to myself like that I didn't know anything. Like I didn't even know what I didn't know. So like by having like that humility and like going into those situations with an open mind and with like good questions was like for sure the most important thing. And I think that like the biggest like realization I had was like growing up like in a very undiverse community, like I like didn't see homelessness or poverty. So like in like through our society, like I think that it was just like really foundational to like my personal growth to like see and understand that everyone is just like me. Like everyone has like these same life goals and like can like everyone's just a person is basically like what it came down to. So like once I adopted that and like understood that, really just going in and listening and talking, it was super easy to build those relationships.
I love that perspective, like 2 years spent listening, watching, and asking questions like that. That's just a great thing that I think not all medical students get that chance. And I think you'll be well set up, and you probably are well set up in your clinical training now to really connect with patients, especially vulnerable patients, patients from different backgrounds. So
Sure.
in many ways, the community engagement approach mirrors the best practices for patient care approach really too.
Mm-hmm.
So Will, I'm just curious if, because I know you spent some time really getting deep into conversations around food and food security and poverty and isolation. And something you didn't mention was this project happened during COVID too, which was a time of massive turmoil and change and fear for a lot of people. So how were you able to make those connections on your side?
Yeah, so yeah, thanks for mentioning that. It was during a pandemic, and especially in the population I was working with like a lot of older people, there was like real fear, especially with people who are experiencing food insecurity about, you know, if I'm going to go access some of these resources, it's going to be a real danger to myself. And I really got that like internal struggle from a lot of people that I talked to. But I think something that was really surprising to me was just how hard it is really to find out how to access all these available resources, and even like much more so during the pandemic because everything was changing like week by week. So I mean, I ended up just basically calling every single place that I could find online, and all the information online was wrong and I had to update everything, make it current. But I think that was really a valuable thing to do because I feel like it can be really disheartening for people to try to access a resource and they think, they're expecting it to be there. And then if you show up and it's not, I think that kind of might deter people from using it in the future. But yeah, I mean, building the relationships with the patients I was talking to, especially because they're being pretty vulnerable and sharing, experiences with me, that requires a level of trust with them. And it was a little hard to develop because I wasn't in person. I had to do everything over the phone. But I think just like kind of what Josh was saying, like it's a huge learning experience, and like, these people's experiences that they're sharing are really valuable to learn from. And I think if you can kind of get that across, like that I'm really interested in, what your experience has been, how do you feel about it, and like what are your needs? And I feel like if you really work with people like that, that's how you can like build that level of trust, and then you can really find out what their real needs are.
Those are really great insights. And again, I think that has a clinical connection to, starting with those good questions and the good questions to draw out the patient's perspective or the community member's perspective before starting to, shotgun interventions or shotgun responses, especially when it comes to complex issues like what you guys are talking about, like food, housing. I mean, these are complex systems that many physicians feel powerless to interact with or engage on because we can't write a prescription for an apartment. We can't write a prescription unless we're in the VeggieRx program that Dr. Ruffalo does. We can't write a prescription for food. So how do we address those things? How do we help people who are facing those challenges? What did you guys learn from your work?
I learned that it's really hard and frustrating. Like, I think that, like, just from, not even from my research, but just like from a clinical experience, like through third year, like when you have a patient that comes in who is clearly housing insecure or food insecure, like as a physician or as a medical student, like I feel like even with like all this training I have and like this research I've done, like I still don't feel adequately prepared to give my patients or these specific patients what it might be that they truly need. Like they might be coming in for a refill of lisinopril, but like ultimately, like if like that might be their immediate health concern, but like a bigger picture need is that they're living under a bridge. Like, and as a medical student and future practitioner, like I still don't know like what to do with that in a clinical setting. Like I know that I can send them to social work, like if there's a social worker in the office or on our floor, but like ultimately I think that like after this experience in the community and after going through third year, I think that to like set myself up to be an effective practitioner in the future, I think that in any clinical setting and in any specialty, I think that it's especially important to like be aware of community resources, because every physician is going to have patients who have needs that go beyond what they're presenting with. And I think that the vast majority of us chose this field and chose medicine because deep down we want to help people. And to help people, sometimes it's more than just their presenting clinical need. So by being aware of like community resources and like being fluent in like that area too, I think that you're going to be able to do the most good for your patients.
That's a great perspective, and that's much of what I mean. Will, that was a big part of your project was compiling those resources and updating them and checking up on them as things changed dynamically during COVID, and even being a support for patients who are struggling to navigate those systems. I'm curious about your answer though. What do we do on the clinician side to how can we best help individuals struggling with these lack of basic needs?
Yeah, I mean, I totally agree with a lot of what Josh said. I mean, I think we should view it as part of our jobs to understand at least, some of the resources that are available for people, and also just to not get tunnel vision on like Josh said, like refilling medications or that kind of thing, but like be aware of these background, like big picture things that are, in some cases have more of an impact on someone's health than, what they say they're coming in for. And so I think, yeah, just being aware of what's available to help people, because wouldn't help connect them with that.
I was having a headphone issue, so I missed part of what you said. I think that was on my side. Is that right? Did everyone else hear Bill there?
No,
Oh,
well, you
that
cut out for like
might have been my internet.
30 or 45 seconds. Yeah.
Oh, okay. Sometimes my headphones do that, so I thought that was just me. Do you want to kind of restate or summarize the last bit of what you're saying there, Will?
Yeah, sure. Am I good now?
Yeah,
Yep.
you're good.
Okay. So yeah, I think I was just saying, like echoing a lot of what Josh said, and just like it's really important to just be aware that these issues are in the background of everyone's life, playing a role in their health and their life overall. So yeah, I think just being comfortable with what resources are available and being comfortable having the conversation with one of your patients and just asking like how can I help you? Like, what do you need right now that I might be able to connect you with? And if you do have some knowledge of what's available in the community, I think you will be able to really help people out by connecting them with that stuff.
Are there, yeah, I really appreciate that answer. And that sometimes an easy thing to say and a harder thing to do, to really be aware of what's going on in the community, because there's a lot of stuff going on in the community. A lot of stuff is changing often. And as you found, as Will and Josh have found, it's not a obvious thing to learn about those resources and stay updated on them. So it's really an active process to make those resource connections in an effective way. But what are some other ways that community engagement can expand our or your purview or power to help patients reach their health goals or reach optimal health?
I think that like community engagement is so important in that, because it's super easy to, especially MCW, because it's so, like, realistically, it's so removed from the Milwaukee community. It is easy to not be community engaged and like sit in clinic in TOSA and like not see problems that are affecting our community. I think that community engagement and going to the people and going into the community, you can more accurately see what the current state of affairs and what the current needs are of the community. And by being community engaged, you're bringing resources and care to the people that might not have access to you otherwise. So I think that by promoting community engagement and by being community engaged, like, you're reaching a far greater number of people than you would be if you weren't developing community engagement, if that makes sense. At least like that's like been like my understanding and like feeling throughout these last 3 years.
I think that's a good answer. Definitely the accessibility is an issue in our healthcare system. Access is not enough though. It's the way that access is available and the way that we meet our community members. And much of what you're doing is getting to a place the community is more comfortable, which is fantastic, and helping and understanding the needs truly to develop better systems for the community perspective. So I'm curious for each of you, in the work that you've done, how do you feel like you've developed your capacity? And you can answer that however you would like to through doing this work.
I think that it's definitely helped me to build my capacity in the sense that I feel that I have sort of reached a larger population than I initially started with, just by the nature of like going to the clinic with Dr. Johnston and like meeting all the staff there. And, I've had some conversations with a couple of the residents afterwards, where I learned that they are actually like now thinking about food insecurity more and like continuing some of this work in the clinic. And so I think that as kind of like an extension of like my little project and like what I've done, like it's kind of like branched out a little more and sort of allowed that original idea to have like a bigger effect on people, which I think is super cool and would not have happened had I not, been engaged with the people at this clinic and, talk to them about my ideas and stuff.
Yeah, and I think like a big part of like my own capacity building was like understanding my like the ways that I could grow my capacity, but then also understanding like what pieces were already in place. So like, for example, I worked with Street Life. So like to gain trust in the community, like I think that like I inherited that capacity through Street Life because like they already had street credibility and trust in the community. I didn't have to reinvent the wheel by like going under their umbrella and like going out with them. Like I gained a huge piece of my capacity in the community by like just inheriting that trust associated with them. So like by understanding that, I think like that's a huge piece of community engagement is like not like having to rebuild the wheel, like taking advantage of like the pieces already in place, so that you can develop your capacity in other ways. So like because I gained that, I was able to develop like these community engaged research principles, like that part of my capacity. So like I had done other research previously, like so I like had grown like my research capacity in other ways, but by developing community engagement, I like learned how to effectively communicate by observing and listening and just learning in the community. And I built capacity that way, which like brought like an entirely like new dimension to not only like my research skills and my academic skills, but also to my clinical skills. As I went out into the community, like being in clinic is like one way, like you're always developing like your capacity as a clinician, but by going into the community and like seeing people where they're at and like seeing how people are living, like and just like meeting them where they're at, I think that you can totally like grow your own capacity and your own tools and skills in a way that you wouldn't have by just going to clinic every day. So I think like that's definitely a way that I for sure have grown my capacity over the last 3 years.
Those are great answers. I just from the outsider's perspective, seeing you guys develop, I'm very excited for the impact that you'll be able to have going forward in all kinds of different ways. And those ripples that Will was talking about are just going to grow for each of you. I'm curious what you think about how your community partners have developed their capacity through your work with them or as a result of your work with them.
I guess I can start on that. So I think this kind of relates to a little bit of what I was talking about. Because when I came in and I brought like this brochure with all these food resources and all this information, I mean, that was something that they can now use at the clinic to sort of help their patients. And also just like bringing, like collaborating around this like central theme of my project of food insecurity. I think just sort of like, and like from some of the results of my project, like knowing that it is like a huge issue in their patient population, I think just like brought some more awareness and kind of maybe like sparked some more action in this area at the clinic. So I think like in that way, like the capacity there's definitely increased in the sense that like maybe they're more aware and able to like see this in their patients and also more aware of how they can help. So I think that that's definitely a way that my community partners gain capacity.
And for I think with any community partner, like a huge piece of their of like what they want to do is build sustainability, and by joining and being consistent and showing up every week, I think that I was able to help build capacity just because like I have encouraged dozens of other students to come out and have created somewhat of a model of like student sustainability so that like there's always going to be new students coming out to engage with them on their outreach routes. So I think like that piece of sustainability was important, but also by introducing like the piece of healthcare and health resources for homeless outreach has been like the other piece of capacity that has increased with them. We didn't even like, we do like mostly like wound care and stuff related to that. But I think like that wasn't a piece that was being done previously. So I think that just by introducing like small bits of healthcare and with the opportunity to develop more in the future, I think that's like the level of capacity that I was able to help directly with.
I completely agree with what you have both shared there. And I think you've really trailblazed and many are following you in those directions. We didn't talk too much about dissemination, but that's okay. I'm more interested if there's one last bit of information or advice that you would like to share with these first, second, third year students who are kind of perhaps in your footsteps on their way through becoming community engaged physicians.
You could go first, Josh, if you want to.
Okay.
I saw you on mute.
No, all good. I think that like my last like soapbox is like it doesn't matter like what specialty like you guys ultimately decide to go into. Like every physician can be a community engaged physician, and I think like a huge part of that is just like learning and understanding the social determinants of health. Like if you can take like one thing away, like please just like be aware that like no matter where you are, like if it's Brookfield or the south side of Milwaukee, like everyone like has social determinants of health and everyone has problems outside of their immediate like medical concern. So I think like it's super important to always just like think big picture and always like have that mindset when you go into any sort of clinical interaction that like sure this person has like X pathology, but like what is going on like deeper than that? Like, is it a housing concern? Is it an adverse childhood experience? Like you can always like think on a bigger picture level. And I think like that's been like my biggest takeaway, like these last 3 years, like regardless of specialty, like we can all have like a huge impact with the platform we've been given.
I think my advice would be specifically related to doing like community engaged research is that it is like if you're working on a research project, it's easy to be like very like get tunnel vision on like your research question, but I think I would encourage people to think a lot more broadly while you're doing your research about like the systems that are in play. Like for me with food insecurity, like I did a lot of thinking about, you know, what are these systems of community food resources and how can they be improved? Like, how do we better meet people's needs? And none of those were really like specifically my research question. Like I was kind of just like doing a lot of screening for food insecurity and that kind of thing. But I feel like there's a lot to be learned. And as Josh said, like a lot of it is just like asking questions and listening and realizing that you don't have the same experiences as the patients you're working with. And it's really important to learn from their experiences as well. So I think my advice would be it's good to have a good research question and focus on that, but I wouldn't tunnel vision on it too much. I would focus on some broader issues as well.
Excellent advice from both of you. Thank you so much for being with us. And some of the lucky students will have the chance to continue engaging with Josh and Will in the breakout sessions. The rest of you will be stuck with us faculty. But we're going to move to the breakout sessions. The focus of the breakouts is going to be your guys' futures in community engagement. And we want to give you some time to reflect and some kind of time to troubleshoot and brainstorm and chart future directions. So there was an email that went out with these questions, which you may refer to from Erica. But if not, if you don't have access to that, just take a screenshot of this or take a picture with your cell phone or something like that. We'll be engaging with these questions in the breakouts.